So when a patient comes in to evaluate for knee pain, one of the first areas we'll start to look at is just with basic x-rays. We look at x-rays to look at the bony alignment. We also look at the joint space on the x-rays to see if there's any narrowing. Really what we're trying to determine is if there's any loss of articular cartilage. So when we talk about arthritis, it's very important to understand what that is. It's a very common term, but poorly understood for the most part. So arthritis describes inflammation of the joint, but the inflammation of the joint is really caused by the wear and tear of the articular cartilage, the white gristle on the end of the bone, wearing away over time. One of the best analogies to think about is how concrete weathers over time. Over time, smooth concrete can develop cracks, it can develop fissures, it can even develop softening, delamination, and potholes. And essentially that's what our articular cartilage does as well. So articular cartilage wear and tear is actually described by the term chondromalacia. And chondromalacia is in effect what causes inflammation of the joint, giving us our term arthritis. So if we want to treat arthritis, we need to manage the inflammation.